at Village Optical today, and I'm joined by Dr. Cody Van Dyke, talking about how an optometrist is somewhat unique when it comes to what doctors do and what you are. So give us a little bit of an overview of what an optometrist does.
Absolutely. So an optometrist is, to get a little complicated, a provider of primary comprehensive vision care for all Manitobans. What that means, first of all, is you don't need a referral to see your optometrist. You can call them right now. You can go to the Manitoba Association of Optometrists website, use their Find an Optometrist tool and find one near you. You can call them up and you can get your eyes checked. And we provide that service to the entire family. Manitobans of all ages should be getting their eyes checked regularly. We can talk about how often a little bit later, but it's something that everyone should be doing. It should be part of your regular health routine.
Okay. Some people might be a little bit nervous about the idea of having you poking around in their eyes. So let's talk a little bit about what that session looks like, or what a visit to the optometrist would include.
So an eye exam usually starts with a history, questions, same as many doctor visits, and then we can break it into two parts, and the part that most people think about is getting your prescription checked, you know, 1 or 2, which is clearer, and that's a really important part of it. Of course, we want you to be seeing your best, but there's a big conversation that has to come from that. Do you want glasses? Do you want contacts? Do you want both? And if you need glasses, do you need just distance ones? Do you need progressives? Do you need something targeted for office or computer use? There's lots of lens technologies, there's lots of options out there, and the optometrist is the right person to have that first conversation with. The other part of the eye exam that is crucial and that we need to talk about more is the health check. So looking at the health of the eyes and the visual system, the skin and around the eyes, the surface of the eye, of course having a good look into the back and checking the important structures there. What's crucial to remember is there at all ages can be eye diseases or ocular conditions that are changing your eye, but you don't know yet. When we think about baby boomers, we think about macular degeneration or cataracts. Your vision can be 20/20, your vision can be perfect, but your optometrist can detect those early changes, diagnose you with the condition, start treatment, and hopefully prevent those more negative outcomes. Also for little ones, a lot of the time when a kid needs glasses, there's no obvious symptoms. They don't talk about blurriness or headaches or things like that. Get their eyes checked.
Okay. Yeah, sure. I mean, kids don't know what they don't know, right?
Exactly.
And when things just kind of progress, they have no idea that something is up. So
and they might not need glasses in grade 2, but they need them in grade 3. So we want to make sure we're getting those regular exams every year.
Okay.
Great part of the back-to-school routine.
Yeah, and as you mentioned, I mean, some of the things that you'll be able to detect, even as adults, we wouldn't necessarily be able to, know that our vision is blurry, but sometimes those aren't always symptoms. So regular eye exams, that brings us back to how often?
So if you are age 19 to 64 and you don't have a condition impacting your eyes or the health of your eyes, every 2 years is great. Okay. If you're outside of that, so anyone 18 and under, any seniors, elders, patients with diabetes, or patients with other conditions impacting their eyes or ocular health, it should be once a year.
Okay, and kids, that's a free visit?
Yes, kids' eye exams are covered under Manitoba Health, comprehensive care once a year, absolutely.
Excellent.
No reason not to.
And you touched on it at the beginning, but if they need to find an optometrist, where do they go?
Manitoba Association of Optometrists website has a Find an Optometrist tool. Where are you in the province? What neighborhood are you in? And you can go from there.
Thanks so much, Dr. Cody. We appreciate the chat.